Hi, my name's Rachel and I'm going to be performing a comprehensive head-to-toe exam today. And so first, I've already washed my hands and now I'm going to introduce myself to my patient. Hi, my name is Rachel, and can you tell me your name?
Anna.
Anna. All right, Anna, well today it sounds like we're going to be performing a head-to-toe exam. Thank you so much for letting me examine you today. First, I'm going to start by assessing general appearance, noticing that Anna is able to hold her own gait appropriately. There's no labored breathing. And so general appearance looks good, and she appears to be in good health. And so what I'm first going to start with is inspecting the scalp. So Anna, what I'm going to do is just look in your hair. And I'm just going to be inspecting for any abnormalities, any lesions, anything like that. I'm going to also just go ahead and palpate your scalp and your cranium just to make sure there's no bulging, no masses, no abnormalities. So first off, I noticed that hair is evenly distributed across her scalp, that the scalp skin tone color itself is not erythematous, there's no alopecia, and there were no bulges or masses that I noticed upon palpation of the cranium. And so I'm also just going to look at your face and notice that there is facial symmetry. I'm going to assess cranial nerve number 7, which is the facial nerve. And so to do that, Anna, what we're going to do is I'm going to have you puff out your cheeks. I'm going to have you close your eyes, and then I'm going to have you raise your eyebrows. Yep, and so that movement was symmetrical, and I was able to do all of it appropriately, so cranial nerve 7 is intact. I'm just going to also palpate your face, or touch your face, and I'm just going to notice the facial bones. I'm also just going to assess your temporal arteries, and then I'm going to have you open and close your jaw. Okay, and there was no crepitus, so just assessing for any crepitus over the temporomandibular joint. What I'm also just going to do is look in your eyes now, and I am going to especially be assessing for cranial nerve number 2, the optic nerve. And so to do that, Anna, I'm going to first notice that your eyes, the pupils appear equal and round. Upon inspection, I notice that the sclera is white. I'm just going to pull your eyelids down, Anna. I see that the conjunctiva, the eyelids, they all look to be without any inflammation, any swelling. And so what I'm going to do is perform a few tests on you, Anna. And so to start, I'm going to be assessing for cranial nerves 3 and 4 and 6. And so to do that, I'm going to assess for any fields of confrontation to make sure that you have peripheral vision intact. So what I'm going to have you do is look straight ahead for me and tell me when you see my fingers.
No. No. No.
Okay, and then moving to the other side.
No. No. No.
Okay, so that's testing cranial nerve number 2. But then to test cranial nerve number 3, 4, and 6, what I'm going to do is assess for any extraocular movements. And so I'm going to have you keep your face straight ahead for me. So without moving your face, I want you to follow my finger. Okay, and then I want you to follow my finger as it goes in. Okay, and the pupils do constrict appropriately, react appropriately, and accommodate appropriately. I didn't see any extraocular movements. And so we've tested both cranial nerve 2, cranial nerve 3, 4, and 6. And so now what I'm going to do is actually look in your eyes with the otoscope, and I'm going to make sure that my eye is my left eyes with your left eye, my right eyes with your right eye. And so I'm going to first just shine a light just to look. So look straight ahead for me. Okay. So I see both direct and consensual pupillary constriction is intact. So what I'm going to do now, Anna, is just look in your eye. Okay, just look straight ahead for me. So I notice the red reflex right away. I notice the retinal background is intact. It's not erythematous. I see the optic disc and appears to be well delineated and circular, highly vascular, the veins and arteries, the macula. So now I'm going to look on this other side. Anna, bear with me, almost done. Okay, and again, see the red reflex, the macula, the optic disc is well delineated. I see the veins and arteries. Retinal background is not erythematous. So we're looking good. And so now what I'm going to do, we've done head, we've done eyes, and now we're going to do ears. And so I'm going to start by first inspecting your ears, and I'm going to see that, but before we move on to ears, I have one more thing for you to do. I'm going to have you cover and uncover your each eye. And so again, testing for any extraocular movement. So I'm going to have you cover one eye, look straight ahead, uncover, cover the other eye, yep, uncover. Okay, and so I don't see any abnormalities noted there. So now moving on to the ears, what I'm going to do is first inspect them. I don't see any swelling, any discharge coming from them, and so any abnormalities, any pain or tenderness? Okay. So then what I'm going to do is assess cranial nerve number 8, the acoustic nerve. So what I'm going to do is whisper a few words to you, Anna, and you just repeat them back to me.
Light, bright, tight.
Okay.
Cat, dog, live.
Yep, exactly. All right. So our hearing is intact, and so what I'm going to do now is just look inside your ears. All right, so bear with me, moving them up and back. So I see the tympanic membrane is gray, the acoustic canal is not erythematous, the light reflex, or cone of light rather, looks intact. And I'm going to come over here, look in this here. So again, see tympanic membrane, the cone of light, no erythema in the auditory canal, tympanic membrane's nice and gray and not retracted. So no abnormalities. And so we've done head, we've done eyes, we've done ears, and now we're going to do nose. And I'm going to inspect your nose, Anna, and just see and notice that there's no abnormalities that I notice. No, none whatsoever. Now I'm going to actually look in your nose. So look up for me. Yep. So I see, hold on. The turbinates, the mucosa, do not appear to have any redness. They're nice and fleshy pink. I also noticed that the septum is midline. So I'm going to palpate your sinuses. So I'm going to just palpate in the top right here. Any pain or tenderness? I'm also going to palpate your orbits, your turbinates, your orbits, and then also your lacrimal duct. Any discomfort there? Okay, and I did not notice any discharge come from the area. And so now what I am going to do is just assess with light touch to make sure sensation of your facial nerve is intact. And so for that, I am going to, hold on one second, use the tip of my sweater right here. So I'm going to have you close your eyes, and what I'm going to do is just have you tell me when you feel me touching you.
Okay.
So, just tell me when.
No.
Yep.
No. 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 No.
Perfect. So, the trigeminal nerve number 5 is intact, and so she does not have any decreased sensation anywhere. So after assessing head, eyes, ears, nose, we're going to move on to our throat. And so for that, what I'm going to do is have you open up your mouth, Anna, and I'm going to have you stick out your tongue and go, ah, okay? So I noticed, go ahead and shine a light in there too. Okay, say ah one more time. Yeah, so I see that the uvula is midline, the hard and soft palate are intact, and the uvula rises when Anna says ah, which is consistent with cranial nerve number 9, and then we're assessing cranial nerve number 10 with the gag reflex, so yeah. Okay, great. So gag reflex is intact, so cranial nerve 9 and 10 are intact. And so what I'm going to do also is just assess your tongue movement. So stick out your tongue and move it side to side, up and down. Yep, and so cranial nerve 12 is intact. I also would have noted that because her speech is clear, logical, and well-paced. So now what I'm going to do is move on to inspecting your neck. And so I don't see any obvious abnormalities, no inflamed thyroid gland, no goiter. And so what I'm going to do is just assess range of motion of the neck. So I want you to put chin to chest for flexion, and then extension, look up. And then for lateral flexion, I want you to turn side to side, and then lateral rotation is I want you to not turn your head side to side. Perfect. So range of motion of the neck is intact. I'm going to assess cranial nerve number 11, which is the accessory nerve. And so against resistance, I'm going to have you do a shoulder shrug. And then I'm going to have you turn your face towards me and then towards me. Yep. Awesome. And so I noticed that cranial nerve number 11 is intact. I'm also going to have you clench your jaw for me. Yep. And so moving on from there, I'm going to now have you turn to your side, Anna. And so I'm going to actually palpate your trachea. Sorry, Anna, maybe a little uncomfortable. And then the sternal notch. I noticed that the trachea is midline, and so what I'm going to have Anna do is swallow for me. Yep, and I did feel the thyroid actually flow freely between my hands. And so thyroid gland's intact, no abnormalities there. And so what I'm going to do now is move on to assessing Anna's chest. I'm going to first notice that there's no obvious abnormalities. She has well-paced breathing, it's unlabored. Chest symmetry is present. I'm just going to palpate your spine. Anna, any pain or tenderness there?
No.
Okay. And the spine is midline. So what I'm going to do is just percuss the area, assessing for resonance. I'm going to have you turn a little bit more this way, Anna. Yep. And then I'm going to assess your thoracic expansion, so take a deep breath for me. Yep. And there is symmetry of the expansion of Anna's lungs. I'm going to assess tactile fremitus, so say 99. 99. 99.
99. 99. 99.
Okay, and no abnormalities there, felt the vibration equally on both sides. And so what I'm going to do now is assess diaphragmatic excursion, which is just assessing to make sure that there's no abnormalities with the expansion of your diaphragm. And so I want you to take a deep breath for me. Okay, and then I want you to let it out. And then take in another deep breath and let it all the way out. And then hold it. Okay, so I have my 2 points, and I would use that to measure the diaphragmatic excursion, which is different on each patient, but it does appear to be normal on Anna, and I would measure it on both sides. And so what I'm going to do next is just assess for any costovertebral angle tenderness, which would be right down here in the costovertebral angle, which would be indicative of any kidney problems. Any pain or tenderness, Anna? Now I'm going to auscultate and listen to the lungs. Take deep breaths for me. Okay, so I noticed with that there was no abnormalities, the lungs were clear, and so what I'm going to do now is have you turn back around to Anna and face me. Awesome. I am going to now inspect her anterior chest. I'm going to first just look. I don't see any obvious abnormalities. So I'm just going to palpate the area, no abnormalities that I notice. And then what I'm going to do is just percuss, again listening for resonance. Okay, and I don't notice any areas of dullness. And so now what I'm going to do is just listen to the lungs. Deep breaths for me. All right. So I don't notice any abnormalities. The lungs were clear in all lobes and didn't have any adventitious breath sounds. So what I'm going to do now after assessing the lungs is move on to the cardiovascular system. So I'm going to have you lay down that way, Anna. And so what I'm going to do is first assess for any obvious heaves or thrills or anything that's abnormal. And then I will actually palpate the area over where I would listen for heart sounds just to make sure I don't feel anything abnormal, and I don't. But I will go ahead and feel for the point of maximal impulse. And then what I'm going to do is listen. And so I'm going to listen first to the aortic with the bell and the diaphragm. Using the bell and diaphragm for each of these, assessing for any bruit, and going to pulmonic. Herb's point. Tricuspid. And then the mitral. Again, assessing with both diaphragm and bell of the stethoscope. So now, Anna, what I'm going to have you do is turn on your left side. So again, feeling for the point of maximal impulse, but also auscultating for it. So I'm going to feel, it should be, yep, fifth intercostal space, mid-clavicular line, and then I'm going to listen. Okay, and I don't notice any abnormalities there. I didn't hear any murmurs whatsoever. So now what I'm going to do is move on to inspecting your abdomen. So I'm going to have you just lift up your shirt, Anna. Great. And what I'm going to do is first inspect the abdomen. I don't notice any abnormalities. I don't notice any scarring, any visible masses, anything like that. So what I'm going to do first is auscultate and listen to the 4 quadrants of the abdomen, starting with the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. I'm also going to go ahead and listen to the abdominal aorta. Then the renal arteries. With the bell and the diaphragm. And then the iliac. And then the femoral. Okay, and then what I'm going to do is then just percuss the area, and so I'm going to just be listening for tympany throughout. And I did hear tympany. What I'm also going to do is just listen for any areas of dullness over the spleen. Now I will go ahead and actually measure the liver span. And so I'm going to have you take a deep breath for me, Anna. Okay, let it out. One more deep breath. Let it out. Deep breath. Let it out. And then one more. Okay, so normal liver span would be 6 to 12 in a on the mid-clavicular line, and then 4 to 8 in the mid-sternal line. And so what I'm going to do now is just palpate the aorta, which is palpable, and that is normal. And then I'm going to palpate the femoral arteries. And then just assess for any inguinal lymphadenopathy, and there is none noted. So what I'm going to do now is just palpate lightly, looking at my patient for any pain or tenderness whatsoever, and then palpate more deeply. Okay, any pain or tenderness there? Okay, and then what I'm going to do is now just feel for the liver. And so what I'm going to have you do, Anna, is just go ahead and take a deep breath for me. And then, yeah, let it out. So I was not able to palpate the liver. There was no inflammation and no swelling there after doing a Murphy's test. And so I'm also just going to assess for the kidneys. Yeah, take a deep breath for me. Okay, let it out. And palpate the kidneys over here. Yeah, and then the spleen. Okay. So, then before I have you get up, I want to make sure that there's no fluid overload as well. And so what I would have you do is turn your head to the side, and then I'm just going to be looking for any jugular vein distension, and I do not see any. No, I don't see any. And so what I'm going to do now is assess your, again, I already assessed the carotid pulses earlier, but assess your carotid pulses, or temporal pulses, and then your carotid, one at a time. And then your brachials, your radials. We assess the femorals, the popliteals, and then, so that we can see them, the postibial on both sides, and then the dorsal pedal. So Anna, you can go ahead and lower your shirt, and I'm going to move on to just assessing and making sure there's no pain or tenderness in the lower right quadrant of your abdomen. And I want to do that before I assess any range of motion or anything else in your legs, just to make sure there's nothing painful. And so what I want to do is first feel at McBurney's point, which is the right lower quadrant, and feel for any rebound tenderness. And then also roving side, which if it were positive would be tenderness on the right side when I pull up. Any pain or tenderness with that, Anna? Okay, so now what I'm going to do, if those were positive, then I would need to assess further for any signs of appendicitis. So now what I'm going to do is I'm going to move on to the lower extremities. Having already assessed the pulses, then I'm going to assess range of motion in your legs. I'm also going to just assess and make sure that there is no pretibial swelling, which there is not. And then I'm going to feel for any calf tenderness, any pain. Okay, so now for range of motion, what I'm going to do is have you start with the hip. So for range of motion of the hip, I'm going to have you do flexion and extension of your hip. So I want you to raise up your leg. Yep. And then I want you to pull your leg to the side here. Yep. An extension. Good. And I would do that on the other side as well, but for purposes of this exam, we'll show one side. With that, I'm going to do it against resistance, and so flex and then extend. Yep, good. And then again, I would do that on the other side as well. What I'm also going to have you do is abduction and adduction. So for adduction, I'm going to have you cross your leg over your body, and then with resistance. Good. And then your other leg. Good. And then I'm going to have you go ahead and abduct, which will be bringing your leg out. And then against resistance. And then do it with the other leg. Yep, and then against resistance. Good. Now with your knees, what I'm going to have you do is flexion and extension of the knees. So you're going to raise your knee up, and you're going to, yep. And while you're there, I'm just going to do against resistance, yep. And then go ahead and keep your knee where it was. I'm going to also have you do internal and external rotation, just again assessing for any hip problems. Good. Now go ahead and lift up this leg, flexion, extension, against resistance, and then internal, external rotation. Okay, nice. So don't notice any abnormalities with the hip or with the knees. So what I'm also going to do is assess now with the feet And the ankles, assessing for flexion and extension. So go ahead and flex and extend your ankles or your feet. Good. Now against resistance, pull up and then push down. Good. All right. And so what I'm going to do next is have you sit up for me. And what I'm going to do first is just look at your upper extremities. So I'm just going to feel, I don't feel any obvious abnormalities of the shoulders. And then I'm going to just look at your fingers, the joints. I don't see any issues there, no areas that are swollen. And so what I'm going to do now is just go ahead and assess range of motion. And so what I want you to do for your shoulders, Anna, is flexion and extension. So flexion and extension of both sides. Yep, and then against resistance, flexion, extension. Yep. Good. And then I want you to internally and externally rotate your shoulder for me. So do this and like this. Yep, on both sides. Good. And then what I want you to do is abduct and adduct your shoulders. And so we're going to do this. And then we're going to go out. Same, adduct and abduct. Good. Any pain or tenderness there? And so what I'll have you do next, so I don't notice any abnormalities there, no, nothing that would give me concern for rotator cuff tear. There's normal range of motion of the shoulders. And so what I'm going to do now is have you do flexion and extension of your elbows. Yep, against resistance. Yep, good. And then flexion and extension of your wrists. And then against resistance. And then flexion and extension of your fingers. Good. And so now what I'm going to do is just assess your reflexes. And so starting with your triceps and then your biceps. And then your brachioradialis. All right. And going over here with triceps. And then biceps. Your brachioradialis. All right. Awesome. So we have normal reflexes that appears to be intact. And so what I'm going to do next is just assess your popliteal or your popliteal reflexes. And so, patellar reflexes. So, yep, good. And then I'm going to assess your patellar reflexes on the other side. Yep. And then what I'm going to have you do is just relax your foot for me and assess your Achilles reflex. Okay. And then with the other foot. Okay. So all reflexes appear to be intact. So what I'm going to do now is just assess with light and dull and soft touch. So again, soft touch and then sharp and dull. Okay? So starting at the top, we'll work our way down. So just tell me whether you, first starting with soft, let me know whether you feel this sensation. So,
no.
Yep.
No. 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 No.
Okay, and up here. careful to assess on both sides of the leg, making sure that there is normal sensation. And so now we'll do sharp and dull. So keep your eyes closed for me. And
sharp.
Yep.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Let me just take your socks off. Okay.
Sharp. Dull.
Okay. So normal sensation appears to be intact. So what I'm going to have you do next is keep your eyes closed for me, Anna, and just assess position sense. And so I want you to stretch out your hands like this and just tell me whether I'm going up or down with your finger.
Up. Down. Down. Up.
Okay, and then with your toes, just point them out for me.
Down. Up. Down. Up.
Okay, so there's normal position sense, and now I'm just going to assess your neural sensation. And so just let me know when you feel the vibrations stop when I place this on your thumb, okay?
No.
Okay.
No. No. No.
Okay. And then one more thing I'm going to have you do before I have you stand up is I want you to open up your eyes, and I'm going to just have you touch your nose to your finger to your nose and then to my finger. Yeah? Okay, and then with the other finger. Good. And then I'm going to have you do heel to shin on both sides. And that's just assessing for ataxia, and so just making sure before Anna stands up that there's no ataxia. And so what I'm going to do now is have you stand up for me, Anna. Yep, and so we've already assessed range of motion of the hips, of the shoulders. Now we want to assess range of motion of the spine. So first what I'm going to have you do is face this way for me, Anna. And I'm going to have you touch your toes to flex your spine. And then I'm just going to assess your spine and see that it is midline. I don't see any areas of scoliosis, no bending or odd curvatures of the spine. So now I'm going to have you stand up and hyperextend your spine. Then what I'm going to have you do is do, excuse me, lateral rotation of the spine. And so, yep. And then lateral bending from side to side, like you're picking up luggage, exactly. Okay, great. So we have good range of motion of the spine. So what I'm going to have you do now is just assess more balance. So I'm going to have you go heel toe. Excuse me. Yep. And then I'm going to have you walk just on your heels. And then just on your toes. And then what I'm going to have you do is do a tandem test where you're actually walking like a duck. Yeah, walk down like a duck. Perfect. And then one other way to assess for balance is to do a Romberg test. So I'm going to have you close your eyes and just make sure there's no abnormal swaying, that Anna's still able to hold herself up with her eyes closed, that she has good balance. Great. Okay, and so all of that looks good. Anna, thank you so much again for letting me assess you today and completing this head-to-toe exam. Anna appears to be in completely great health. I did not see any abnormalities whatsoever, and that concludes today's exam. I would end by washing my hands and exiting the exam room. Thank you.